One of the key things that we want to do as we electrify these premises is to really learn what is the perfect sustainable model going forward. Putting the kit in and electrifying the place is the easy part. We then need to see how can we encourage more members of the community to use the facilities. How can we get the health compounds themselves to see the benefits of having 24/7 access to light and to energy? Talking to the nurses, they were so excited and asked us, when can you bring them? When are you going to come and install?
So this is an opportunity to restore their ability to operate at a high quality of service and to expand and grow to improve even beyond where they have previously been at, to have more robust, more reliable, long-term source of energy for everything from domestic use by staff to blood centrifuges and sophisticated equipments that they would use to monitor and treat patients.
The program objective is then to electrify 35 of these rural health facilities, tackling these challenges by connecting them to tailored smart solar nanogrids and providing them with the same necessary energy efficient appliances for lighting, refrigeration, phone, laptop, printing, internet connection, and radio charging. And also by training 15 young local entrepreneurs to the building, operation, and maintenance of the systems.
As a business, we see that as an opportunity for us to be able to diversify and expand our offering, while at the same time making a lot of impact. And I mean, it's something that we already built on. We are built on impact. We see ourselves as more of a social enterprise.
To have a real impact, it's better to do it in a smaller area and do it well. So we chose the province of Sofala, the one that was mostly impacted by the Idai cyclone. It's a 2.3 million people province with more or less 120, 130 health facilities. So we have selected those that they don't have electricity, or they are having really serious problems of energy.
We did a baseline study, did our audits, did our assessment of this healthcare, and found out what they need. And between then and now, the state government have done a fantastic job in providing equipment. This is from ventilators to small X-ray machine that are needed at this primary health care center, because they are closest to the people. And these are people that live in either rural areas or peri-urban areas. The goal is to provide electricity to serve these facilities and ensure that the people who live within those neighborhoods have reliable and good healthcare solutions.
We have one solution to two major problems for millions of people around the world, which is lack of access to energy and lack of access to clean water. So typically we install our box in the community, and it can serve households, but it can also serve institutional buildings, or like a clinic or a school, or productive uses like irrigation or welding or milling, that kind of thing.
For the health centers, we expect an improvement in the quality of the services provided so far. For the population living around, about 27,000 people will benefit from quality and affordable health care. Our solar hand-washing kit will also help to significantly fight against COVID-19 in the selected region.
We would like to electrify health facilities which exist in rural and hard to reach areas which are not connected to the national grid. The connection to solar systems is intended to help these facilities have a cheap, clean, and reliable source of energy.